Good morning. I am Dr. S. Praveen Kumar, neurologist from Super Specialty Hospital, Bangalore. On the occasion of the World Purple Day, I am here to dispel certain myths about epilepsy. Epilepsy is a neurological disorder resulting from abnormal, excessive neuronal electrical discharges which affect the brain cells and result in episodic abnormal behavior of the patients. Epilepsy is a treatable disorder and adds to the global economic burden. Epilepsy is a treatable condition, and till now we have many of the newer anti-epileptic drugs for the same. Epilepsy is prevalent among developing nations including India. The treatment of epilepsy requires the prompt diagnosis and investigations. Despite various efforts throughout the world prevailing to dispel the myths and misconceptions, still the patients with epilepsy are not forthcoming for prompt investigations and management. There is requirement of more awareness programs that will reiterate that epilepsy is a disease like any other and that people with epilepsy are no different from others. Here are certain common myths about epilepsy. Epilepsy is the result of possession by evil spirits. The treatment is to exorcise such spirits through faith healers or alternative therapies, whereas the reality is that epilepsy is a neurological disorder that can be treated with anti-epileptic medications, and no amount of exorcising the evil spirits through faith healers or alternative therapies will help. The patients with epilepsy should meet specialist doctor, preferably neurologist. Myth: an epileptic attack can be stopped by making the patient smell an onion or branding the skin with a hot needle or iron rod. Reality is that such methods are not going to help in the treatment of epilepsy and in fact are harmful to them. Myth: if you touch an epileptic patient during a seizure, the disorder will pass on to you. This is a myth, and the reality is that epilepsy is not a contagious disorder and will not spread by touching an epileptic patient. Myth: epilepsy brings stigma to the family, so the patient should be hidden, whereas the reality is epilepsy is a treatable disorder and there is no reason to hide an epileptic patient. Myth: epilepsy is a form of madness and the patient needs to be admitted in an asylum. Reality is epilepsy is a disorder of brain function and it cannot be equated to madness. We should ensure that the patients with epilepsy get timely diagnosis and management with anti-epileptic drugs. Myth: patients with epilepsy cannot marry nor have children. The reality is that there are no reasons for the patients with epilepsy not to marry nor to have children. If they are diagnosed properly and administered proper anti-epileptic drugs, they can lead a normal married life and have healthy children. Myth: children who have seizures should not be sent to school. The reality is that most children who have epilepsy are intelligent. There may be some coexistent retardation, but that is due to abnormal brain function. Again, as long as the child takes the medications regularly, he or she can be sent to school and then can have a normal scholastic performance. Myth: wearing a metal ring, talisman or offering animal sacrifices will prevent the seizures. The reality is that nothing can prevent seizures except taking the anti-epileptic medications regularly. To summarize, the life of a person with epilepsy can be very manageable and he or she can lead a happy and successful life, contrary to all the myths and misconceptions. This has been possible by the virtue of advent of newer anti-epileptic drugs. If patients start embracing the treatment as a vital part of their lives, epilepsy can definitely be well controlled. Thank you.